Hey, Dr. Spages here. So on today's video, it's really going to get you a perspective of actually how to win and how to reverse diabetes with a strategy. Okay, so I should have probably completed this video 20 years ago, but I thought this is really good, and I think you're going to get a lot of understanding, and you'll be able to kind of do some self-reflection on where you are in the game and what you understand about type 2 diabetes. All right, so hang on, a lot of information to go over, but enjoy. All right, here we go. Let's get started. So over the years, when I meet a type 2 diabetic, it's really interesting to see where they are in terms of their limitations of what they know. And over time, it's really interesting because most diabetics that I meet, even ones that have been diabetic for a long time, have different awarenesses. Now, how do they get this awareness, right? Well, they get it from a lot of things. They get it from TV commercials. They get it from their doctor, their health professionals. Maybe they get it from a neighbor up the road, or a family member who's a diabetic. And they have all of this information about diabetes that is literally bombarding them, almost brainwashing them, but yet they're unsuccessful. And that's the biggest thing I want to focus on is how does a type 2 diabetic become successful? Why is my success rate so high? What am I doing different than everybody else out there, right? And that's really important to understand. One little tip and secret that you're going to understand in just a moment, it probably has more to do with you than it does with me. And you're going to understand what that means in just a minute. But you're thinking, well, I have some special magic wand, or there's some special diet I give patients. And as long as you've been following me as well as looking at the content I have, no, there is no special crazy diet. Yeah, there are rules, and I teach patients the rules, and there are definitely things to do and not do. But you're going to understand how it relates more to you than it does me. All right, so let's actually get into this. All right, so follow along on this diagram here. So when we look at this particular diagram, all right, we see different layers. We see a green layer, kind of like an off yellow layer, an orangey layer, and then a reddish layer. Each of these layers actually means something, okay? So we're going to go layer by layer, and what I really want to emphasize is also the limitations of each layer, and then which layer you need to be on to think correctly to get really good results. All right, so here we go. Okay, so let's talk about the first layer, okay? The first layer is the one where I think it's probably the worst place to be in your awareness of being a type 2 diabetic. And that is where someone has told you that it is genetic. Mom or dad gave it to you, and so forth. And there is a really good video which I talk about this. I actually do the whole entire history of the Genome Project about genetics and type 2 diabetes. The problem with a person saying that it's genetic is that they're left with no hope. They're sitting there saying, well, if it's genetic, there's nothing I can do about it. So let me just let the dice roll, and it's just my fate. And that is a very unempowering place to be. It puts you at literally like just getting beat by the disease, and it doesn't leave a lot of hope. Okay, so that is really the worst place to be. So if I meet a person who wants to get help, but yet they think it's a genetic predisposition, then it's hard to work with them because they're limited with thinking, well, whatever I do is not going to work, and they're just going to self-defeat themselves. Okay, so this is probably the worst place to be because it doesn't leave you any opportunity to get yourself better and to even work hard to getting yourself better. Okay, let's look at the next one. So the next one is pretty much what everybody I meet who is a type 2 diabetic, it's diet and exercise. And the problem with this is that diet and exercise is not usually the reason why your body goes out of balance. Now, of course, if your diet is not good, it makes more stresses on the body. Obviously, if you're not physically active, it definitely creates more stress. But we all know people who have really good diets and yet they're full-blown diabetic. And we also know people who their diets are really bad and yet they're not a diabetic. So if we sit there and just talk about this diet and exercise game, there's no long-term gain on it. Yeah, you'll diet and exercise and you'll lose a couple pounds, but you didn't really fix anything, right? So what happens is the weight comes back, you diet and exercise and so forth. And that's a very limited approach. This is where most people meet me. They meet me wanting to know what is the diet, right? What exercise program? And you'll find out from just looking at testimonials, patients in my office, many of them, I tell them not to exercise. Like I won't take them on as a patient if they're going to exercise until they start getting their metabolism working. Same thing with diet, right? So there are definitely do's and don'ts to dieting, right? But the diet is only a foundation. it doesn't fix all the imbalances, right? And there are many imbalances underneath what is going on with the type 2 diabetic. So I want to isolate one issue here. Diabetes is not the cause of the problem. It is a symptom. It is the effect of a problem. And diet and exercise doesn't fix the root imbalances. And I'm only saying this because I've done this about 10,000 times with comprehensive lab testing. So I'm coming from a point of experience. I know there are people out there that are dieting their way and exercising their way, and maybe their labs improve, maybe their A1C improves, but it doesn't mean that they fix the mechanism that caused it, okay? Most of the times they don't, okay? So anyway, this is the next limitation. Let's go to the third one, right? So medication and supplements. So this is the approach where most type 2 diabetics take, where it's kind of like, all right, get me the right medication or get me the right supplement to control my blood sugar levels. They're doing the same idea with when it comes to cholesterol meds and blood pressure meds. They're going to health food stores or health places and trying to get a supplement to treat the symptom, or they're trying to get a medication to treat a symptom. And the limitation here is it's a Band-Aid. it's just the Band-Aid. So here's an analogy I like to use, right? Let's say in your kitchen there is rotting garbage, right? Like let's say that the garbage is rotting in the kitchen. Well, there's a couple of things you could do. You could certainly go and spray, right? And spray to make the room feel better. You know, it's not a bad idea. And then when that doesn't work, because you know the garbage is getting worse, it's rotting, it's smelling bad, you could take another spray and spray it. But this is not really addressing the root issue. The root issue is you have a decaying, nasty garbage in your kitchen. So what I always think is, well, yeah, of course, spray, because you want to go to the kitchen without being grossed out. But you got to figure out where that smell is coming from. You got to figure out, like, well, what is rotting? What is causing this stench that is so nasty? And that is the approach that I think makes the most sense. And that's the approach I've done for over 20 years, where literally I'm going and I'm actually figuring out where the garbage is in this analogy and then getting rid of it. And when you get rid of the garbage and when you get rid of the smell, the symptoms also go away. And this is how diabetics get better. This is how their blood sugar improves. This is how they lose weight, is by getting to the root issue. So the highest level of understanding your diabetes is from a root cause perspective. That's the only way you're going to win. That's the only way you're going to get the results you're looking for. You're not going to get it from the other levels. Number one is, if you think it's genetic, there's no hope. If you think it's diet and exercise, you're going to be limited because you're really not going to figure out all the things underneath diabetes. And if you're just trying to treat the Band-Aids, well, we all know the Band-Aid approach doesn't work. The only way to actually get diabetics better, or get really any of these chronic diseases better, is by getting to the root cause, by working hard and fixing those things that are out of balance, and going and working and getting it back to balance so your body functions well and you have a quality of life. Okay, so that is the approach I do. That's the only way to actually get yourself better. So I'm really glad you are watching this video, because you could see where you are on this scale and know what different thinking you need to do in order to get yourself better, and to order to actually get yourself in the right frame of mind to actually get really good results. Okay, so thank you so much for watching. I hope you got a lot out of this video. If you like, there's a lot of content here on the website, so enjoy, and I wish you nothing but the best. So remember, be well, stay well, take care.